So good morning, everyone, and again, to our first responders, thank you so much. Our frontline people that are out there every day, whether you're in the police, fire, EMS field, doctor, nurse, LPN, certified nursing assistant, whatever that you're doing out there in a hospital setting or a nursing home, thank you, thank you, thank you. And to the people that are going out there doing jobs we don't talk about, thank you for keeping us moving forward. Obviously, that's why we still have the internet, and that's why we can still use our cell phones. So thank you for the job that you do day in, day out. Unfortunately, we had another death last night, and a 70-year-old female passed away in her 70s with underlying health conditions. So that makes number 9 here for us here in Albany County. Our heart, my condolences goes out to the family, not just to her, but to the other 8 families and to anyone that has a loved one in the hospital. You know, this is the most difficult time because unfortunately these people, when they're in the hospital setting, they have no one around them. At least they have the love and support of the staff that works in the hospital, but imagine how hard that is on them. And how hard it is on the person that doesn't have someone around them, their husband, their wife, their spouse, their lover, their sister, their brother, their aunt, their friend. It's tough, and the seriousness that we're in, and I keep trying to ask people to stay home, isolate in place, don't go out. We shouldn't have to tell you, we're adults. We shouldn't have to remind you every day to stay home, cough in your arm, wash your hands, continue to practice these great protocols that are in place to protect not only yourself, but the people around you. And this is the reason why. When we lose people like this in our community, that are pillars of our community, it's not easy. As of today, we have 330 positive cases. We're up 21 from yesterday. We have 441 people under mandatory quarantine. We're down from 18 from yesterday, which is good. Under precautionary, we have 43 people under precautionary quarantine, down 14, which is also good. Like I said, yesterday there's 309 positive cases, 459 people under mandatory, and 57 people under precautionary. There's 37 people in the hospital, down 2 from yesterday, at a rate of 11.2% of those who have tested positive. Still have 13 adults that are in the ICU. And we haven't even got back our testing yet. That started on Monday, thanks to Governor Cuomo and his team. I can't thank you enough, and everyone involved at UAlbany, the president, everyone that's involved, the National Guard, the Air National Guard, the Army, the Air, SUNY Police, and Forest Rangers, and obviously the governor's people, so thank you so much. I do want to remind people how important it is to stay home as much as possible. Please, please stay home. You know, it's getting very, very serious out there, and I briefly talked about yesterday that the fines were going from 500 to 1,000, and we're looking at that for people having house parties, people gathering when they shouldn't. Had a nice phone conversation yesterday with the district attorney's office, with David Soares, my law department, you know, my deputy county executive, which is kind of weird now having you next to me, Phil, Dan Lynch, and a variety of people on the phone to talk about how we're going to enforce this going forward through the executive order, the governor, and my executive order, because it's serious, people, and we need to remember you're home for a reason. And if you're fortunate enough where you're not an essential employee and you're staying at home, or you're staying at home because you have underlying health issues, pay attention. It doesn't mean you socialize with people on your block or have people over for a cookout. Them days are gone for right now. Pay attention. We received a lot of complaints over the past couple of weeks about people in the community violating the state guidelines from large parties and backyards, businesses still serving people at the bar and restaurants, which we're addressing, and I'll have Sheriff Apple in here at the end of the week to talk more about that. And you know, and I also want everyone to remember you can use the governor's new intake from the report that he put out, encouraging you to Basically, if you need help, if you need to get a New York State's license or whatever it may be, that's a link that you can go to. We've had a lot of people call our office about that, so please take a look at that. And again, you know, this is going to be a tough couple of weeks ahead of us, week and a half, and again, we're trying to find out if we're at the plateau, if we're there. We don't know. Downstate's a lot different than upstate, and you got to remember what's happening in New York City and Westchester, Orange County, and Dutchess and Putnam. We're a week or two behind them. So as they may plateau, it doesn't mean that we're going to plateau. It means we may plateau a week after them. It may all be the same because isolating is working, so please continue to do that. And also remember, seniors that have to go out to the grocery store, we're trying to put mechanisms in place to get groceries delivered. But most importantly, people that need to see their pharmacist. Most pharmacists are delivering. They're dropping off at your doorstep. So keep that in consideration that you don't have to go out. So please keep that in mind. And Dr. Whalen, please, if you want to add.
Good morning. So this morning I wanted to talk a little bit more about numbers and about data and how we are looking at that. As County Executive McCoy mentioned, we are not yet getting the reports of positive cases from the testing that's done in SUNY Albany. This is not surprising. We were told, and we know, that most labs take 24 to 48 hours to turn around tests. So we anticipate we are going to start to get these results later today. But our positives to date and our daily positives today don't reflect this. So we still don't have the idea of what the numbers in the general community are. We do know, and the numbers that we give you in terms of the mandatory and precautionary quarantines are way down. That doesn't necessarily mean that there's improvement. What that is a reflection of is that we don't have any more mass gatherings. So we used to have very large numbers of precautionary quarantines when we had, for example, a case at a school that was still in session, or a case at a church that was still in session. Often we would reach out to people that had been in these larger settings and find out that there may be 200 or 300 people that they have had contact with. So that would cause a great number of precautionary quarantines. Now, as people are following the social isolation guidelines, as most places, workplaces, and places of school and places of worship are either closed or greatly limited in their access to the public, the cases that we get when we start to investigate them really don't have that many contacts. So as we start to move forward, the number that we will be paying the most attention to really is the positive cases. And we anticipate that by the end of the week, we'll get a better sense for what it looks like in Albany County. The other thing that we do, of course, pay attention to is what's happening in our hospitals. And from what we hear from our hospital partners, they are not experiencing the same surge capacity issues that we've been hearing about downstate. All of this leads us to believe that we are not yet at our peak and we still need to be very vigilant. When we look at the numbers around healthcare providers, we're starting to pull the data and make sure that we get a good visual representation for the public, and hopefully by the end of the week or the beginning of next week we'll be launching a database that we can share with you and share with all the Albany County residents. Our cases, about 30% of them have affiliation with healthcare work. So we're looking at those numbers. We're looking at numbers around age. We're looking at, as you know, who has pre-existing conditions, what age groups do the different cases fall into, and we'll be able to share all of that with you. I would say to you that, you know, as I've said before, we have a really wide range of positives across every decade of life. But it does seem that the preponderance of serious cases and the deaths that we unfortunately have experienced in Albany County have been in elderly residents who had pre-existing medical conditions. We will continue to follow this because this does give a picture of what's going on at the county level. From our perspective, as we look at this data, we will continue to inform the public, but I would again reassert the message the county executive has. If our numbers are lower than expected, that means we're doing a good job with social distancing and staying at home. We need to continue that. We need to maintain this vigilance. It is in the community. We know that it's out there. We know that there are people that, now are going to be available, have testing available to them that haven't had this before. So we do anticipate that our numbers will go up. And we need to continue with the very strict guidelines that we've been adhering to stay at home, to continue to be vigilant about hand hygiene. Those messages are still more important than ever. The state has launched their COVID tracker that does give some county-specific data. Another number that we look at is the percent positives of the total number that have been tested in Albany County. As this becomes more widespread in the community, we expect that percentage number will go up. We're still holding at about 7.5%. We'll be paying attention to that number. So it's important to know going forward what the numbers will look like for us and what numbers that we're paying particular attention to. And I'll be sharing more about that as we get farther into this. So thank you.
Thank you, Dr. Whalen. And, like I said, business continues on in the county with essential employees. And one of which is we've gotten questions on is the airport. What's going on? There's planes still flying. Yes, it's still open. It's still going forward. People still have to travel and get to certain destinations via work or other reasons. But I thought no better opportunity than to bring in the best CEO of any airport in the world, Phil Calderone, who used to be my deputy, who left me to go to the airport. But Phil, if you'd like to let everyone know what's going on at the airport, I would appreciate it.
Thank you, County Executive. And if I could first just make a personal observation. They say the test of leadership is whether that leader during a crisis meets the moment. And I think we've been incredibly blessed in this state with Governor Cuomo's leadership. He has certainly met the moment. With County Executive McCoy's leadership here in this county, there's no question that he has met the moment. And with Dr. Whalen's leadership of the County Health Department, she has clearly met the moment. One of the, I think, examples, one of the proof that that moment has been met here is what is happening at the airport. Travel at the airport, the number of passengers going through our TSA gates has dropped by nearly 95%. That's a good thing in terms of people listening to the message that we need to practice social isolation. I listened over the past couple of days to Dr. Fauci and Dr. Birx talking about a glimmer of hope that maybe some of the dire statistics that they had initially talked about in terms of the number of deaths that we would see nationally is not going to be quite as high. It'll be high, it'll be painful, it'll be tragic, but not quite as high as initial estimates because Americans have listened to the warnings coming from leaders like the county executive and Dr. Whalen and certainly from the governor. And they have put into practice social isolation. Internationally and globally, air traffic is down dramatically, well over 90%. And that has been devastating to the industry, but it is a necessary pain to go through to deal with this virus and getting it under control. I'm also incredibly grateful to Senator Schumer. I've become a member of the American Association of Airline Executives, and we lobbied for the CARES Act. And as you know, substantial funding has been allocated in the CARES Act for stabilizing or trying to stabilize the airline industry. In the CARES Act, there's nearly $60 billion for airlines, and then an additional $10 billion for airports specifically. We are working with the FAA and making sure that Albany International receives its adequate share, its share of the CARES Act funding. It'll be based on a number of formulas within the Act that are too complicated to go through right now. But That money will help us substantially in dealing with the dramatic loss of revenue that we're facing every day. Hundreds of thousands of dollars a week, millions of dollars a month that we're losing in landing fees and passenger facility charges. Almost all concession revenue has ended. Almost all concessions at the airport have closed. The millions of dollars that we're losing in parking revenue. And we'll get through this. We are taking steps at the airport to look at all cost centers and to reduce discretionary spending, cutting back on utility expenses and overtime, and trying to find ways, short at the moment, of furloughing employees to reduce expenses, to try to deal with the financial crisis that we are facing. The county executive began by thanking, appropriately so, doctors and nurses and first responders. The airport provides an essential service. We need to remain open. There are flights coming into the airport as we speak, delivering critically needed cargo that is bringing in critical medical supplies, that is bringing in necessary equipment for those first responders and those trying to deal with the crisis that we're facing. We also have medevac flights coming in, and we have folks who need to travel for essential businesses because they work in critical industries that are important to keep the systems that we rely on operational. So the airport, its employees, the airline employees, the TSA employees, the air traffic controllers at the airport. There are so many essential workers in our industry and at our airport who are coming to work selflessly every day, and I want to thank them. We began at the airport probably sometime in mid-February reviewing disaster preparedness plans, our pandemic preparedness plans, and our emergency preparedness plans. I put together a coronavirus task force that I'm extremely proud of. We met daily throughout the month of March, and up until just a few days ago, we were teleconferencing every day. Dr. Whalen was a critical part and is a critical part of that task force. The sheriff and the sheriff's office has been a critical part of that task force. The county executive and his representatives have been an important part of that task force. I've had TSA representatives, FAA representatives, air traffic control representatives on the task force. Albany Medical Center, Dr. Daly is a member of the task force. Dr. Greenberg, a member of the authority board, one of the most prominent physicians in this region, a member of the authority board for a long time, a former flight surgeon himself, ENT physician, has been an important resource for us and a daily participant in those calls. And we have reviewed our protocols on a daily basis to make sure that we are following best practices to protect passengers coming through the airport, to protect workers at the airport. So far, I'm happy to report that I'm not aware of any of our workers or any of the airline workers who are in the airport, using our airport, who have come down with coronavirus and needed to be quarantined. But we were able to put into place very early on, I think, safety practices and protocols that I think then were modeled by other airports. I know that very early on, before other airports were doing it, we were working with our air traffic control, for example, to establish contingency plans should there be an incident of coronavirus in the air traffic control tower, setting up a remote tower to make sure that we had a continuity of operation if we had to shut the control tower down and had to move operations to somewhere else in the airport. on the airport grounds. And as you know from reading the paper, there were other cities throughout the country where there weren't contingency plans for that kind of an event, and it literally halted transportation, air transportation, for days. So, I think we were extremely proactive, and that was a result of a tremendous, effort by a task force that was really dedicated and committed to making sure that we had best practices in place at the airport. I read an article just the other day about what will the airline industry look like coming out of this. There's the optimistic view that there's a pent-up demand for travel and that we'll rebound and be stronger than ever. They cite the fact that fuel prices are lower, airfares have dropped and are far more competitive, and an optimistic belief that hopefully, when we turn the corner on this and the economy opens up, that our industry in particular will come back very strongly. There's another view that is a little bit more pessimistic, and it says that in a post-coronavirus world, we're all going to be affected. There's an article in The Atlantic that says we're moving into no longer a post-9/11 world, but we're going to be looking very shortly at a post-coronavirus world, and what will that world look like? And in this analysis of our industry, there's no doubt that there are a number of airlines that will not survive this crisis, despite the relief in the CARES Act, and that there will be mergers of airlines, and that there will be routes that will be dropped, and that there will be just because of the social distancing practices that have been put in place, a disinclination of folks to take the kind of leisure travel excursions to far-off destinations that they might have in the past, and that will dramatically affect our industry. I don't have a crystal ball. I don't know what the effect will be. I do know that we have worked closely with the signatory airlines at the airport. We have established great partnerships with them. They appreciate the cooperation and the understanding that we have had of the situations that they're going through. And a number of those airlines have indicated in planning flights for June and beyond that they are going to continue to be committed to the routes that we have at the moment. That could change day to day, but I think it's important that we have established those partnerships with the signatory airlines, and I appreciate the relationships that we've developed. We're going to get through this, and we'll get through this because of the leadership of the folks at the county executive and Dr. Whalen. And again, I want to end my comments, and I'm happy to answer any questions, by expressing my profound admiration of their efforts and my gratitude for what they have done, not only for the airport, but for our community. Thank you both.
Thank you, Phil. And one of the reasons why in the beginning I said you have to have a contingency plan, and I divided my office into three elements for this reason here. And the same thing working with the airport. So and the same thing I put out to the business owners and the media and companies, that this is something you have to worry about going forward. On a positive note, I'd like to thank Shaker Place Rehabilitation and Nursing Home Center, the staff helping the residents. They actually put for the rainbow, made some balloons and put it out. They helped us decorate the place in the spirit of the 518 Rainbow Challenge. So thank you to the staff out there and to the residents. As always, people, our mental health line's constantly up. They're there working from 8 a.m. to 8 p.m. 7 days a week, and the number is up where you can see it, 518-269-6634. Thank you, Dr. Giordano, and all the people that have volunteered on top of the workers that are taking phone calls. And as always, the 211 number and the New York State hotline number to call also if need be. And I want to again thank the John Signer from OTB for letting us put all the stuff out there on, through Schenectady and Albany County. So thank you for that.